Good morning and welcome to this session on health systems. I am Dr. Chiu, and I will be guiding you through an introduction into the role of health systems in today's society. This session has 3 parts, since it is important for you to first appreciate the value of health and healthcare before you can appreciate the value of a health system. You would understand why individuals, communities, and nations value health. You will also then understand why it is necessary for individuals to use appropriate health care to improve and maintain their health. And finally, you would then understand the value of a health system, which is to organize and distribute health care in the population. Let us then begin by examining the value and meaning of health to society. This is the World Health Organization's definition, which states that health is the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a very expansive definition. Health is not necessarily just the absence of pathological disease or physical injury, but also encompasses emotional and mental well-being, concepts which are less tangible and less easy to measure. This often referred to definition of health has attracted criticisms because of its extremely wide scope and the perception of health as a discrete state which is either present or absent in an individual with no gradation in between. However defined, health is valued almost universally by individuals, communities, as well as nations. Individuals value health basically because being healthy allows them to better pursue economic and leisure activities. On the other hand, communities value healthy individuals because they contribute to overall social well-being. On the larger scale, nations value healthy communities because they can contribute to national economic well-being. Since health is valued, individuals, communities, and nations need to understand the factors that can promote health. What determines the levels of health that individuals, communities, and nations enjoy? The determinants of health are many. These include individuals' biological characteristics and behavior. For example, an individual's genetic makeup may predispose her to develop certain physical and mental disabilities, or an individual's smoking habits may predispose her to develop lung cancer. Factors within the physical environment. For example, an individual who lives in a slum may not have access to clean drinking water and thus may have higher risks of developing diarrheal diseases. Factors within the social and economic environment. For example, improvement in educational opportunities for women can lead to better health for her family. Some determinants of health, such as inherited genetic conditions, are not modifiable at the present time, but many others are, such as educational opportunities for women. Thus, since individuals, communities, and nations, or collectively referred to here as the society, value health, then it is rational to expect that society works towards promoting factors that can improve health. It has been argued that health is a basic human right which should be enjoyed by all. Thus, it is not just rational thinking to expect society to improve health, but that society has a duty and responsibility in enhancing and protecting the health of all. In other words, society must do so. This is reflected in this statement, which is part of the Constitution of the WHO, which states that the enjoyment of the highest attainable standard of health is one of the rights of every human being without distinction of race, religion, political belief, economic, or social condition. The focus of societal action should then be on determinants that are not just modifiable, but also those that require systemic actions, that is, require systems of many interacting players to carry them out. In addition to just improving overall levels of health, these systems should also aim to ensure that the distribution of health conforms to society's values. In other words, health should be distributed in a just and fair manner acceptable to society. In 2005, the WHO set up the Commission on the Social Determinants of Health, essentially to produce evidence to guide society on what actions are of proven value and thus should be emphasized. As the Commission clearly puts it, social determinants of health are the conditions in which people are born, grow, live, work, and age. These conditions are shaped by the distribution of power, money, and resources at the global and national and local levels. These social determinants of health are mostly responsible for the unfair and avoidable differences in health in our society today. The point here is that health is not simply about individual behavior or exposure to risk, but that the socially and economically structured way of life of a population can shape its health. This concludes the first part of this lecture, which is on the understanding of the value of health. Here are some additional reading material which will provide more detailed discussion on the issues I have mentioned.